If you want awesome products at great prices, check out the in the description. The crumbling foundation. England's elderly face a decade-long wait in hospital corridors. The harrowing reality of England's NHS crisis is laid bare in a chilling new report, painting a picture of elderly patients languishing for days, even weeks in hospital corridors, awaiting a bed. A Freedom of Information request filed by the Liberal Democrats has unearthed shocking statistics, revealing the extent of this unacceptable neglect, leaving many questioning the future of healthcare in England. The data, compiled from 54 NHS trusts across England, reveals a stark and deeply concerning trend. A staggering 68.4% of patients enduring trolley waits, periods of 24 hours or more spent on trolleys in A&E, are aged 65 or over. In 2024 alone, out of a reported 48,830 such waits, a gut-wrenching 33,413 involved elderly individuals. This equates to thousands of vulnerable seniors forced to endure the indignity and potential health risks associated with prolonged stays on trolleys, often in cramped and unsuitable environments. Some accounts detail waits extending to an appalling 10 days, a period that equates to a significant fraction of a month spent in unsuitable conditions. The sheer scale of this crisis is further emphasized by the fact that this data represents a likely underestimate asterisk. The Liberal Democrats' analysis only includes information from 54 out of 141 trusts, meaning a significant portion of the true extent of trolley waits remains shrouded in uncertainty. The actual number of patients enduring 24-hour-plus waits could be far higher, painting an even grimmer picture of the situation. The geographical distribution of this crisis is equally troubling. East Kent Hospitals University NHS Foundation Trust emerges as the worst offender, reporting a staggering 8,916 trolley waits of 24 hours or more in 2024, a dramatic increase from a mere 30 in 2019, before the pandemic exacerbated the pre-existing issues. Liverpool University Hospital's NHS Foundation Trust follows closely behind, with 4,315 such waits, also representing a dramatic escalation from 10 in 2019. These figures represent a catastrophic failure of the system, highlighting the urgent need for systemic reform. This isn't simply a matter of inconvenience. It's a critical issue with potentially devastating consequences for patient health and well-being. The Royal College of Nursing, RCN, aptly describes the situation as a crisis in corridor care, echoing reports of patients being treated in hospital corridors due to a critical lack of available beds. The RCN further highlights the alarming decline in nursing recruitment as a significant contributing factor to this worsening crisis. The shortage of qualified nurses exacerbates the strain on the system, making it even more challenging to provide adequate care to the growing number of patients requiring hospital admission. The political fallout from this crisis is inevitable. The Liberal Democrats have directly criticized the Conservative government's handling of the NHS, arguing that years of neglect have contributed significantly to the current state of affairs. Labour, now in power, faces similar criticism, accused of failing to implement effective solutions to address this urgent situation. A spokesperson for the Department of Health and Social Care responded by highlighting government actions, including the introduction of a new RSV vaccine, the delivery of over 27 million COVID and flu vaccines, and the end of nursing strikes, enabling frontline staff to focus on patient care. However, these measures appear insufficient to address the root causes of this deeply systemic problem. This alarming situation demands immediate and comprehensive action. The long waits experienced by elderly patients are not just statistics. They represent a profound failure to provide dignified and timely care to some of the most vulnerable members of society. Simply addressing immediate symptoms, like the RSV vaccine rollout or resolving nursing strikes, falls short of the necessary, comprehensive systemic overhaul needed. The fundamental issues of bed shortages, understaffing, and inadequate funding require bold and decisive action. Failure to address these underlying problems will only deepen the crisis, condemning countless more elderly patients to endure prolonged waits in unacceptable conditions, potentially compromising their health and jeopardizing their well-being. The human cost of this inaction is simply too high to ignore. The question remains: how long will we allow this crisis to continue before decisive action is taken to protect our most vulnerable citizens? The answer, for the sake of countless vulnerable individuals, needs to be immediate.